the first session then is basically, state-of-the-art MRA, and we're going to talk quite a bit about trends in utilization for MRI and also MRA and CTA. And our first speaker is Jeff Goldfarb from St. Francis Hospital. And Jeff has done tremendous work in mining all of the utilization data in the US and has probably done more so globally over the past several years. And Jeff is going to talk about trends in the utilization of MRA and CTA. Thanks, Jeff.
Thanks for the kind introduction, Paul. So it's truly my honor to kick off the 34th Annual Society of Magnetic Resonance Angiography, discussing trends of practitioners and practice of MRA and CTA. The only images I'm going to show, because I'm showing a lot of numbers, are on this first slide. The bottom CTA images are downloaded from Google last week, and the top images actually are from 20 years ago, collected on Siemens Vision with Bob Edelman. I think they look pretty similar. When I started to look into the utilization of MRA, I was quite surprised that the techniques on the bottom for some time are increasingly being preferred to the techniques on the top. It's this one?
Are you Keynote or PowerPoint?
PowerPoint.
That's this one. It's the skinny one.
Okay. So the motivation behind this talk is to provide an update on the recent practice and practitioners of MRA and CTA in the U.S. Medicare population. Except for professional society memberships and voluntary registries and surveys, which can be quite biased, little recent information is known about the practice and practitioners of these types of angiography. The data is from a retrospective cross-sectional analysis of Medicare Part B physician payments provided by CMS. The database is big data. It consists of over 777 million lines with 30 data fields about all types of payments. One of the data fields is the billing code. MRA has 12 billing codes, and we can look at MRA of the head, MRA of the neck, chest, body, and extremities. We can also look at the use of contrast in the head and compare that with non-contrast use in the head and neck. CTA has 10 similar codes throughout the body, and of course they're all with contrast. A little bit about Medicare. In the US, Medicare is a national social insurance program administered by the federal government. I'm going to talk about it a little bit because the question is how important is this data to actually look at utilization of MRA. Medicare provides health insurance for Americans age 65 and older who have worked and contributed financially to the Medicare system, and others with disabilities. In 2019, there were 61.5 million Medicare enrollees, approximately 18.4% of the US residents' population. 53 million qualified due to age, and 8.5 million due to disability. In 2019, there were 33 million individuals enrolled in Part B fee-for-service Medicare, the studied population, which I'll be presenting. So Medicare is a piece of the pie, right? So in the US, their health costs are paid by in several ways. Public insurance such as Medicare, Medicaid, state employee health plans, out-of-pocket costs, and private insurance. There was a recent study in radiology where they contrasted actually commercial insurance and Medicare, this type of Medicare that we're going to look at. And they actually concluded that non-invasive diagnostic imaging utilization trends among the commercially insured are similar to those in Medicare enrollees, although at lower rates. So this is good news. So looking at Medicare billing is a good way to look at MRA use and practice. They also showed that earlier rapid growth in all diagnostic imaging has stopped back in 2016, I think was the end of their study, except for CT, where utilization has actually stabilized. We're going to see that this isn't really true for MRA and CTA when you look at them individually. First look, and it's going to be some bad news for MRA. If we look at 7 years prior to the COVID-19 pandemic, the number of practicing physicians in MRA has actually decreased 15.5%, while CTA has increased close to 29%. Diagnostic catheter angiography has increased only slightly. In the first year of the COVID pandemic, actually the people performing MRA decreased 19%, it dropped, while CTA only dropped a very small percentage, and DCA dropped about 10%. It's interesting to look at not only MRA practitioners on the left and CTA practitioners on the right, but a lot of people do both. And we can see that in the middle, people doing MRA and CTA has remained quite stable, while people performing and interpreting CTA and not MRA has seen a lot of growth. And then second from the left, MRA but not CTA is dwindling. That was the practitioners. Here we're going to look at the use or number of exams. A good way to look and quantify it is the exams per 10,000 Medicare beneficiaries. And for CT angiography, there was about 68% increase in chest CTA, 53% in body, close to 200 in head CTA, and 170% in neck CTA. On the other hand, all of MR angiography usage in total has been declining over these 7 years. Only chest MRA, which is almost barely visible there on the bottom, saw an increase in utilization. Body, head, and neck all saw decreases in the number of exams. We can also look at the location where these exams are being performed. They're mostly performed in emergency rooms, hospitals, in and outpatient independent facilities. So looking at the MRA market location, the majority of MRA exams in this population are done in the hospital, both inpatient and outpatient, around 30%, followed by outpatient imaging centers. And then due to the restrictions and time, only about 10% are performed in emergency room locations. CT, on the other hand, is used most frequently in the emergency room, about 40% for hospital use, next as inpatients and then outpatients, and only less than 10% in outpatient imaging centers. So we can look at the number of exams and their change right before the pandemic. So with MRA in the emergency room, there was an increase in use, and in the hospital, both inpatient and outpatient imaging centers, there were close to double-digit decrease. On the contrary, CTA in all locations, especially in the emergency room, saw an increase in usage, but also robustly in the hospital, 59% inpatients and 70% increase outpatients. So looking in the first year of the COVID-19 pandemic, MRA use, a lot of MR scans were pushed back or canceled. So there was a dramatic drop in use in the 20% in all locations. On the contrary, CTA, there was only a small decrease in use in emergency rooms and hospital inpatients, and a larger decrease in use for outpatients, both in outpatient imaging centers and hospital outpatient use. We can go and look at the individual type of exams. All MRA exams over the 7 years decreased by about 18%. These are sorted by the use in 2019, and we can see that head and neck are the most used exams, with head without contrast and neck without contrast actually there at the top. This is followed by body and lower extremity at much lower rates, and pelvis, upper extremity, and spinal MRA at very low rates. If we look at the change in the number of exams over this time period, there was actually some positive growth in MRA of the head before and after contrast, MRA of the chest, and MRA of the head with contrast both saw double-digit percentage growth changes. But the top three MRA exams and a number of other types of MRA exams all saw very marked decreases in use over the time period. So there was a lot of changes in contrast. First, the development of contrast use in MRA, and then NSF and brain deposition. So it's interesting to wonder, how, in the U.S., around the country, how is contrast being used? And we see that for all exams here in the head and neck, the head and the neck, most popular is use without contrast, and dramatically still in the head and neck and head. They all saw decreases in use over the time period, except MRA of the head with contrast, which saw actually a close to 25% increase in use. But this is just a small piece of the MRA pie at 7 exams per 10,000 Medicare beneficiaries. CTA, on the other hand, on average saw almost 90% increase in use, very dramatic. If we look at what CTA exams are done by body part, the majority of CTA scans are done in the chest, followed by neck, head, abdomen, and pelvis, and the others make up a small part. There was growth, positive growth for most of the exams, especially the ones that are utilized most frequently. sometimes over 100%. Only 2 exams saw decreases in use over the time period, CTA of the abdomen and CTA of the pelvis. So I was actually surprised to find out when I first ran these numbers. I went back to check that I wasn't making a mistake. I had started looking at CMR usage, the same type of analysis, and there's sort of a dramatic growth, but clearly MRA use and the number of MRA practicing physicians are decreasing, and we should all know that. On the other hand, CTA use and its number of practicing physicians are increasing. And during the first year of the COVID pandemic, use of both decreased, and MRA's use was 5 times larger than CTA, or decreasing use. Thank you very much for the invitation.